Hi, I'm Cian O'Carroll, and back in 2018 I met Vicky Phelan when she was looking for a solicitor to help her fight her case. She went on to win that case and uncovered a shocking healthcare scandal that has affected so many women and families across Ireland. We also became friends. Vicky went on to fight one campaign after another for women's healthcare in Ireland, and all the time fighting for her own life, fighting for more time. This is a series of conversations where Vicky and I discuss what went wrong in CervicalCheck, how those fatal and life-changing mistakes happened, and look at what Vicky has achieved since she became an advocate for change. Hi Vicky.
Hi Cian.
We're starting off here with this project that you've been talking about for a while. Perhaps you'd like to tell us a bit about that.
So my name is Vicky Phelan, and I contacted yourself, Cian O'Carroll, back in January 2018, almost 3 years ago now, hard to believe, looking for legal representation at a time when I discovered something that I wasn't quite happy with, but I wasn't quite sure what it was. I just had a sense that I had been diagnosed with terminal cervical cancer in January 2018, and 4 months previously, or 3 months previously, I'd had a sit-down conversation with my gynecologist, who just wanted to have a chat with me about an audit that had taken place in CervicalCheck. And this kind of came out of nowhere, out of left field, and I wasn't really sure where it was going. And this was at a time when, I didn't know at that stage that my cancer was back. So when I was told about this audit, the first thing I thought of was, well, was there a chance that I could have been diagnosed earlier than 2014 when I originally got cancer? Because what he told me was my smear test in 2011, just after I'd had my son, had been rechecked with this audit, and they discovered that there was a different result. So the result that I was given was that everything was fine. I had a clear smear, and then this revised result, according to this audit, showed that there was a discrepancy. And all I was told at the time was that there was a query that I could have had cancer. So it was all very hypothetical. At the time, I kind of decided to park it because I wasn't, I still had no cancer. I was happy to be cancer-free at that stage, but then that changed a couple of months later. And I was sitting waiting for a biopsy in a treatment room, bored off my head. And I started looking through my file. I thought, this is the time, I need to start looking now. Didn't even know what I was looking for, to be honest, Cian. And looked through my file, and I found a report from CervicalCheck about this review. And that was it. That was the moment I decided, I just knew from this review, from what I read, that there was more to this audit than what I had been told back in September. And I just decided I needed to get legal representation on this. I had a feeling, just from reading that review at that time, that there was a chance that I could have been misdiagnosed, but I needed help with that. So that's where you came in. And I contacted you, and that was what set the ball rolling, really, with all of this. And I never thought back then, when I think about it, nearly 3 years ago, that we'd be set off one of the largest health scandals in the history of the state, really, with what happened.
And that is what happened. I mean, obviously, I think the audience as such for this conversation that we're having over multiple episodes, really it's intended to be the people who have been affected by the same things you were affected by. And
absolutely. I think I felt that over the last 2.5 years, I've been asked to do lots of different podcasts and interviews, but none of them ever really touched on this stuff, on how to take a court case. How did I, I often get asked the question, how did you know? And I think, that's something that we can kind of discuss. A lot of people don't know how to read legal reports or medical reports. Luckily enough, I'm quite good at reading, complicated documents, but it's not for everybody. And I suppose I've always felt that, there was a gap there for people to understand the whole process that goes behind taking a court case, the whole, and there's never really been an in-depth analysis of what actually truly happened with the whole CervicalCheck program, you know, how it was set up, you know, what is a smear, who analysed the smears before CervicalCheck was established in 2008. So I think, you know, it would be very useful, I think, for people out there to have somebody like me who has been diagnosed with cervical cancer and who has been affected by this issue, and somebody like you who has taken so many cases at this stage and knows all of this stuff inside out. So I think it would be a very useful resource for people to be able to have.
Maybe we have the name for this series,
well,
channel, or whatever you want to call it. From that, we were kicking this around before, trying to figure out what to call this thing. Maybe it should be the Phelan report.
I like it.
because we've obviously had the Scally report, we've had the RCOG report, and neither of those addressed many of the issues that we'll be going through. So
exactly,
that will be something. Back to the idea of the audience then, the target audience as such, or the target classroom, if you want to call it that. It is people who have been asking you questions, and I suppose a lot of people who would be either clients of ours or clients of other firms who don't have access to a lot of the stuff that we take for granted because we've just learned it and absorbed it over the 2.5 years since your case. And those people would tend to be in maybe 3 categories. You've got the members of the 221 group, first of all. And those are obviously either the women involved or their families where they have died, of that group of 221 women who were identified through the old audit. That's the audit that we know stopped as soon as your case began. Then we have the people who had never been subjected to the audit, some 1,500 or so, who were invited to join the RCOG review, plus the people within the 221 group who were also invited. And of those, whatever it was, 1,000 or so submitted their slides to the RCOG review. And from that, a new cohort of people who had been failed, or in respect of whom significant errors had arisen and were detected. So that's the second group, the RCOG group. And then the third group is really kind of a catch-all, and that's the group that is really anybody who has had a diagnosis of cervical cancer since about December 2017, because December 2017 was around the time that the last people who were diagnosed with cervical cancer, there being about 350 a year of women with that distinction, the last group that were admitted to an audit. And everybody since then at 350 a year, which by now would be coming up on 1,000 women, have developed or been diagnosed with cervical cancer, which had been developing for quite some time before that. And if they had a prior screening history that was clear, well then they should have been audited, and they haven't, because the state obviously wanted to turn off the tap on the bad news after your case. And the best way to stop finding out about mistakes is not to look for them. So they shut down the audit, and they still haven't restarted. And you've been asking for that to be restarted.
Yeah, we've been asking for that to be restarted through the 221 Plus group, also through the CervicalCheck steering committee. So 2 of the members of the 221 Plus support group, Stephen Teep and Lorraine Walsh. So Stephen's wife died from cervical cancer and was included in the original 221 women, and Lorraine Walsh also was affected and couldn't have children. And both of those people sit on a CervicalCheck steering committee, so at national level, with members of the Department of Health, the HSE, and others, in order to try and, see how to improve things. And one of the things that we've been asking for consistently since, the steering committee was established was when the audit would be restarted. And, we still haven't got a straight answer on this, really. And I suppose now COVID is a very good excuse for a lot of these things at the moment. But ever before COVID came along, there was still no will, as far as we could see, for it to be restarted.
Yeah, the excuse, we're meandering off the agenda as such for our opening episode, but that's probably a good start.
Yeah.
The excuse that was given, or the reason, I should perhaps be less prejudiced in my outlook here, but what the heck. The reason that was given was that the non-disclosure that had occurred, and we'll come to this in a subsequent episode, the state loves to talk about the great sin of non-disclosure. And that is where the audit had taken place, a discordant reading had been discovered, and that discordance was not communicated to Vicky Phelan or to any of the other women. And obviously there's been a state apology in respect of that. But non-disclosure hasn't killed anybody.
Exactly.
The errors in the reading of cervical cytology, that's what has caused that. And those errors have never been investigated. But the explanation that was given at the time for stopping the audit was that they had to figure out how to achieve a system of disclosure before they could restart the audit. And that this was such an insuperable problem. If you Google disclosure of cervical cytology audits, you'll find that the UK managed to get on top of this problem in 2004. And they've published a handbook on how to do it, including nice precedent letters. And it was co-authored by Dr. Karen Denton, who has been working with, apart from working with CervicalCheck in their lab audits, which we'll also come to, she was also working with Gabriel Scally in his work, as far as I understand. So she's the author of exactly the manual how to do this, is somebody closely associated with the HSE. And I think they revised and updated their system in 2008 or 9 in the UK. And presumably she was involved in that as well. But it's there, it's sitting on a shelf. It's actually available online. And so I don't buy their excuse that they couldn't, that they're still working on this impossible problem of how to tell women the results of an audit. It suits them.
It does, unfortunately, yes.
So that's who we're trying to provide information for. And the next thing, I suppose, to look at is really what are the general areas or topics that we're going to cover. But from our own point of view, I think episode 2, you're going to be having a look at the HPV assisted screening, which is part of the discussion. Screening itself, liquid-based cytology, the pap smear, what that is, how it works.
After that, then what we're going to look at is CervicalCheck and how it started. So, you know, before CervicalCheck was established in 2008, you know, we had a national system of laboratories, an ad hoc system really, where there were laboratories, 14 laboratories, I think, around the country that looked at screening, and women would have just presented to their GP. There was no rollout or no letters issued to women. It was kind of on an ad hoc basis, and it worked quite well until, you know, there was a bit of a backlog in 2006, particularly in the west of the country, and that's what prompted a look at, well, you know, if there's a backlog now, how are we going to deal with this? And that's when Quest, an American company laboratory, was brought in to clear the backlog. And at the time, it was only intended that it would clear the backlog, but obviously that led into a tender then for the whole new CervicalCheck system, because a realization that we didn't have enough laboratories in this country to roll out a national screening program. So, you know, I think it's very important to look at the background to CervicalCheck and what existed before it came along.
And then we're going to look in a further episode. We might take up more than one slot dealing with all of what you just discussed, because that's a huge issue, and that is the heart of it. I mean, outsourcing is, at least in our opinion, I think.
Yes, 100%. It was the crux of all of this. Yeah,
this disaster.
Yeah.
And it continues to be. You know, you said they brought Quest in, but of course, if only they brought Quest in, well, perhaps that might have been a better solution. But they shipped all the slides out.
Yeah. Yes, exactly. So that was the problem.
And in some cases, they went to the four corners or the four winds. In any event, the next thing to discuss then, I think, would be logically coming to your case and having a look at, in a sense, a case study. But also then moving on from that, looking at what we and others learned as a consequence of your case. Because when you look back on the newspapers in the days and weeks following that day in April 2018, rather, when you stood on the steps of the forecourts. You just see this cascading story and little landmines going off all around the place as the health services grappled with revelations that led to obviously significant resignations and led to at one point it did look like there was the potential for the government to fall, with Fianna Fáil wavering as revelations came out around what the Minister for Health knew in the days before your case came to trial. So there's all of that to discuss. We have the audit and what we learned about that after your case, because remember, when your case was going through both the development stage here in this practice and then through the early days of the trial before it settled, there were an awful lot of things that are central to cases now that we didn't even know about.
Yeah, exactly.
So it's a little bit like the space program. You know, you were like the Gemini rocket, and it was, you know, it was amazing. It was amazing what it achieved and that it got up there and its spacewalks and everything, but it certainly wasn't capable of landing on the moon. And so there have been progressions since then, and things have, I can only say, Vicky, I'm afraid things have got a lot more complicated.
Yeah. Well, I think the beauty, if that's the word to use, or the advantage of being the first case, I suppose for you and for me, was that, you know, the HSE didn't know what was coming. You know what I mean? We had that. I think they were much more ready to release documents. You know, we got documents at the time, didn't we, in the run up to the court case, which, you know, had they known what was coming, they probably wouldn't have released them as readily, I think. So, you know, I think there was an advantage. And also, I do think they were quite confident that I would not, you know, that I would sign a non-disclosure agreement, that I was that sick. I think they were really expecting that, you know, I wouldn't be as bolshy, I suppose, and as stubborn as I am. They weren't banking on me, basically. I suppose that's it. And they thought this would go away. No more than I did. I mean, that day I stood on the steps of the court and gave that statement, Cian, and I didn't think I'd still be here, you know, nearly 3 years later, still, you know, fighting for answers for women and for myself, and trying to improve outcomes for women and for the screening program.
Yeah, and that point of refusing to go along with the non-disclosure agreement, I mean, obviously it's been discussed before, and I know that it's probably something that a lot of people have interviewed you about and referred to, but you and I have never talked about it, so it might be something that we would look at it in a little more depth, because we were in the room together as that was being put to you, and off camera we'll have to get I'll have to get you to release me in terms of solicitor-client privilege, but it was a very interesting time in the case, and that changed everything. Yeah, and it certainly meant that the trial had to go on, but the trial could only go on so long, and it was a matter of how much pain they were suffering in court, hearing the evidence of your experts and how impressive they were. And I think it reached a point where they just didn't see any alternative to settling the case, and that's how that came about. Yeah, but I still don't imagine that they expected anything like what did happen, because that was in some ways a fluke.
Yeah, I think so.
It was a fluke. Other people in the same situation, even with your ability to communicate clearly and concisely, could have been in that situation, and it wouldn't have come together into what happened. It was this combination of all of those things I said before about your communication skills. The figure was very important. 2.5 million was a headline grabbing figure. Yeah. And there had been, sad to say, many other fatal cancer misdiagnosis cases before, and none of them had achieved that level of damages. And I think a lot of that was really down to Siobhan Ryan here, my colleague, who had really come up with some very novel ways of approaching or understanding the harm that a family suffers when a mother is lost, and then finding ways to document that with experts to support that. And there were other factors as well, but you know, you were a big earner with a professional career, and that has an effect on these things. But nevertheless, it was the figure itself was quite an important part in telling that story. And then, of course, you had the disastrous radio interviews that followed it.
Yes, that definitely helped.
Probably remember some of those, can you?
Yeah, of course I do. Yeah, I think we all do.
They weren't your interviews.
No, I was always prepared. I've never, you know, thankfully, I suppose, you know, people often say to me, you know, you always come across really well in interviews. And I said, yeah, but I think what people don't see, no more than you, Cian, you know, the preparation that goes into it. You know, you have to prepare for these interviews. You can't just talk off the top of your head. You have to have your facts right. And you have to be measured. And I think that's one thing that I've had, you know, as an advantage, I suppose, that I've always been very measured, and I haven't totally slammed the health service. You know, it was a very difficult balancing act at times for me, because I knew I could easily come out and slam the whole health service and, you know, tell women not to go and have their smears. But at the same time, I knew if I said that women would probably listen to me, and I did not want that to happen, because I didn't want women to stop going for their smears, because I know how bad this cancer is and there's no cure for it. So I didn't want more women being diagnosed. You know, in fact, I wanted less women. So it was all about, at that stage, trying to expose the harm, but also to work with them to try and improve the system. And that's what this has been about, really, for the last, you know, 2.5 years.
We want also then to run through the Scally report, well, the scoping inquiry as it was originally, the various laboratory inspections that took place. That's an area that people don't know about, these 5 or so inspections that had taken place during the lifetime of the outsourced laboratories operating 2008 to, I think 2014 was the last inspection that was done.
It was, yeah.
Case. And I'll have to prepare and brush up on that stuff just to make sure I'm right on all the dates. But yeah, it was pretty extraordinary that you would have outsourced 90% of the nation's screening programs. So close to 250,000 slides or tests per year. They go out to outsourced laboratories, not all in the States. Some of it was done in Dublin, and some of it was done without anybody's knowledge in laboratories that didn't have any approval in the UK, although they were, a particular laboratory was incredibly past fit. But that all of this was happening, and that there were only those 5 inspections of several labs over the course of, 6 years. And then a 4-year gap when nobody even knocked on a door and said, how are you doing there, lads? So I don't know how you expect standards to hold up. I mean, everybody says, oh, well, there's professionalism and all of this, but, you know, if there isn't somebody looking over your shoulder, you're bound to have bad days. And clearly
Absolutely.
they did.
Yeah. And that was one of the shocking outcomes, you know, from the Scally report, was the lack of, you know, quality assurance, you know, and that was a big shock to us, you know, particularly when we sat down with Gabriel Scally to read the report before it became public. You know, I really was quite astounded, to be honest, at the number of labs, you know, that the HSE and CervicalCheck knew nothing about, that they were, you know, sending smears to in the States. You know, it was absolutely, and to this day, I mean, I still don't know which lab my smear was sent to. I mean, they told me it was Austin in Texas, but, you know, the one in Austin in Texas was sending smears to other labs in Honolulu and Orlando and all these places that, you know, HSE knew nothing about. So it's quite extraordinary. Yeah,
it does say Austin, Texas at the bottom of the report, but it is possible. I haven't seen any of that, of the exotic Honolulu slides or reports. So it's possible that they didn't write the laboratory down at the bottom of those ones.
Yeah.
And of course, famously, Dr. Scally, when asked in the Oireachtas committee what he thought of quality assurance in CervicalCheck, he said it was non-existent.
Yeah, yeah.
Didn't quite say that in his report, and he did ultimately say that the labs were good to go now. But that was something which perhaps I thought was a bit of a leap, given all of the problems that he had uncovered. But maybe we can come to that in a future
And if ultimately everyone was facing the problem that cervical screening is important and has to be maintained. And if you decide that laboratories are unsafe, well then what do you do? You don't have capacity here at the moment, and that's something that I wanted to come to as well later, which is statistics and numbers, without hopefully sending people into a
coma.
We'll try and do graphs and lines and drawings and all that kind of stuff, but just to have a look at things like comparing laboratory to laboratory, how are they performing? And looking also at the Irish Cancer Register statistics to see what they really tell us about the rates, the incident rate of cervical cancer and death from cervical cancer. But really, I think the important one is the incident rate of the cancer itself over the period, looking at a year or two before CervicalCheck began, then in 2008, and following it on up to, I think 2018 is at the moment, or the last available statistics, because it has been stated repeatedly that there has been a very significant decrease in the rates. But in fact, those statistics only apply if you look at 2010 to 2015.
Yes.
If you take that period out, you have a distortion of the statistic. Surely you have to look at the period from CervicalCheck starting. And I have pretty strong views on statistics in these matters, and I think that they clearly have been, as they say, the old line, used like a lamppost to a drunk, more for support than illumination.
Okay, so in the next couple of episodes then what we're going to look at is Pembrolizumab, which is the drug that I am on to keep me alive, basically, and how I had to fight to get access to this drug because it wasn't licensed for cervical cancer. This was another thing that I discovered, when I went to try and find something to keep me alive. So, I think there's a huge amount of interest in this because it's one of the questions I get asked most often by people, and people contact me from all across the country asking me how I got on the drug, how do you get access to it? What do you need to do? So I think it's something that people are, would like to know about. Another episode that we're going to talk about is obviously, one that, one of the reasons I wanted to do this with you, Cian, is how to take legal action. That's, again, apart from asking me about drugs to keep people alive who are terminally ill. The other question that I get asked most often is how to take a legal action if you think you have been misdiagnosed. Because again, I suppose I'm very lucky that I have the research skills and I was able to, do all of that myself back when I did do it. But some people wouldn't know where to start, even to try and find a good medical negligence solicitor. A lot of people wouldn't even know that that's the title, the type of solicitor that they would need. So I think it's something that we could touch on definitely to give those people out there who maybe think that they might have a case, information on how to do that. And then that kind of leads us into, the landmark case, Ruth Morrissey's case. So, my case only achieved so much. It obviously exposed the whole CervicalCheck scandal. But I didn't get a lot of, what I was looking for. I didn't get an admission of liability. I got an apology, but it was, I still don't really accept it, to be honest. It didn't happen at the right time. But, cases subsequent to mine have happened and they've achieved far more. But, as you explained to me before, somebody has to be the first, the oldest child to learn and make all the mistakes and learn the hard knocks.
I think you're wrong here. I know I'm talking
really?
over you, but I think you're wrong here. You got a fantastic apology because it came without even asking for it.
Do you think so?
Nobody had to negotiate it. Nobody had to ask for it. Out of the blue and unasked for, having struck out the case against the HSE, Tony O'Brien wrote a letter to you where he, I think, very sincerely apologized for the harm and acknowledged the wrongdoing. So it was an admission of liability and an apology, and it was furnished unasked for with great sincerity, I think. Now, you could be cynical and say, oh, look, he was just covering himself or whatever, but I don't see that ever happening, and I've never seen it happen since.
Okay. That's interesting because I suppose the way I look at it is, it didn't happen during why drag me to court in the first place then? Do you know what I mean? And then apologize after the fact for, and that's the way I look at these things, I suppose.
Don't let it sound like I'm praising the HSE for the way they've acted in this or other cases. I mean, you were about to talk about the Carrick case from, as we're speaking now, it was just last week. And that, in October of 2020 is the first time the HSE have admitted responsibility and apologized.
Yeah, and I have to say, when the judgment came that day, I was so delighted to see that. I thought this is a huge step, that they're actually apologizing and accepting responsibility, because, obviously with the Ruth Morrissey case, which we will obviously be discussing in a lot of detail, because there was a lot of landmark judgments in that case, which was appealed and went to the Supreme Court. Up to Ruth's case, the HSE were not accepting any responsibility, and then the Supreme Court found them primarily responsible for the cervical screening program. So, they could only accept responsibility after Ruth's case, but Patricia Carrick's case was the first case where that did happen, and hopefully, it opens the way for further cases where this will happen for women and families, so that they don't have to go through what women like myself and Ruth and Patricia Carrick and Emma Vicky Phelan went through. So, I think there's a lot to be discussed in the cases, case by case, from my case to Ruth's case, then to Patricia Carrick's case. So there's a lot there in those alone, just for people to understand how they have moved on and what you have achieved, because, these have all been your clients. What you have achieved in a matter of, less than two years, really.
And just to wrap up then, because we've explained now what the series is about. I suppose it's kind of like a YouTube channel, is it?
Yeah,
what it's about, who it's aimed at, and the topics that we intend to cover.
Obviously, the plan was that we would do these recordings in the same room together. It would make things a lot easier than having to rely on Wi-Fi and not having children while I have the door locked, barging in and finding time, isn't it? Like anything. But unfortunately, we are in the middle of the COVID-19 pandemic. So all of this is going to have to be done remotely. So I'm at home in Limerick, and Cian, you were in your office in Cashel, I believe.
Yeah. So I'm in the conference room of our office, not the room where you and I first met, but hence this rather elaborate fireplace behind me, which is a huge sort of a reddish marble thing. It's a lovely building here, but it's maybe not the best spot in the winter.
No, I can't imagine. Plenty thermal vests.
Hi. Vicky and I hope that you've enjoyed that episode and you're finding the series informative. If there's anything else that you'd like us to discuss or touch upon, please mention it in a comment below. And to be informed of future episodes, hit the subscribe button.